Good afternoon to all of you who are joining us here in person in Geneva, and for those of you who are joining online, good morning, good afternoon, good evening. It's my great pleasure and honor to warmly welcome all of you to this very timely and important conversation. I apologize for the delay. One of our speakers has been delayed in arriving, and when he arrives, we'll whisk him onto the stage, but we thought it's important to get moving as our time is limited, and the topic is a big one to tackle. So certainly this is this conversation looking at two-speed multilateralism, as we've called this event, comes at a very timely moment when the multilateral system is under severe stress. The world order and the post-war institutions that were created to address global problems, I would say, is at a unique moment of rupture, possibly collapse or transformation, depending on where we go from here. Welcome, please join us on stage. We're very grateful to our co-sponsors for this event, the World Health Organization, the International Institute for Sustainable Development, IISD, and the Geneva Environment Network, and we thank you sincerely for your support and your cooperation in bringing this conversation together. Of course, one arena where transnational cooperation is of urgent importance is climate change. We need few reminders of how this accelerating crisis is impacting all societies, lives, and ecosystems worldwide. Just last week, the World Meteorological Organization issued their State of the Global Climate Report for last year, confirming that the last 11 years were the hottest on record, that 2025 was the second or third hottest year since temperatures really began being tracked 150 years ago, and are estimated at now 1.43 degrees Celsius, very, very close to the 1.5 limit that we were supposed to have stopped at. So clearly we are not moving fast enough. The multilateral governance system is not mobilizing political action fast enough to address climate. Of course, climate is also a health issue and increasingly recognized as such. WHO has identified it as a top global health priority, and there's growing evidence linking it to a wide range of health issues, including heat-related illnesses, air pollution, vector-borne diseases, mental health impacts, food insecurity, and probably there are things that I've left out, but certainly a very, very daunting and wide-ranging set of health issues related to climate. At our center, we recently published a working paper reviewing the academic literature on the global governance of climate and health, and indeed we do see an increase in high level of attention to health in climate discussions, and vice versa, increasing attention to climate in health governance processes. But governance processes are continuing to evolve beyond that. We see new forms of collaboration, including the theme of this event, two-speed multilateralism. So what do we mean by two-speed multilateralism? One is that when actors get frustrated with the pace of what's happening in the universal multilateral system, often the UN system, and they want to move faster, they will engage in bilateral or minilateral clubs in order to try to push progress faster. And of course, one example of this is the phasing out of fossil fuels, where consensus was not reached at the last Conference of Parties, at the last COP, to take action on that. Now, it's a very timely moment to consider the issue of phasing out fossil fuels, given the war in the Middle East. Of course, the closure of the Straits of Hormuz has brought the world to the brink of an oil shock of historic proportions that may rival what we saw in the 1970s, or even surpass that. And we are currently potentially on the cusp of a global economic recession, not to mention other political, economic, humanitarian, and social consequences of this oil shock, including health. So in this context, we are extremely lucky to be gathering together and to have with us the key actors who are involved in both speeds of multilateralism. We have representatives from the government of Turkey who are online, and you'll meet them in just a moment. Turkey is, of course, hosting the next COP and will hold the COP31 presidency. Australia, who is also represented here in the room, has been appointed as the president for the negotiations. And Turkey and Australia together will be bringing the global community together to try to advance progress. Prior to COP31, in fact, in just a few weeks' time in Colombia, Colombia and the Netherlands will be convening the first international conference on transitioning away from fossil fuels in Santa Marta. So we're very delighted to have a representative from Colombia, whom Daniela will introduce to you in just a moment, and of course WHO and IISD, who have both been central to really bringing health into the climate agenda and climate into the health agenda. I just wanted to remind us before we dive into the content that two-speed multilateralism is certainly not a new phenomenon. Ever since the UN was founded 80 years ago, there have been parallel bilateral and minilateral processes that work alongside global multilateral processes. And we know that minilateral and bilateral processes can directly influence what happens in that broader arena. The key question is, do they influence that for good or for bad? Right? Do they help push forward the action that's needed in the multilateral process? Or is there a risk that they take the air out of the multilateral processes and fragment governance? And these are questions that scholars who have studied international relations have wrestled with for many years. As we move towards COP31 and the implementation of the WHO Global Action Plan on Climate Change and Health, we will be exploring today how these traditional governance processes and these new coalitions, these bilateral and minilateral governance processes can advance health. We're going to ask, how are we progressing on the climate and health agenda? How does the emergence of two-speed multilateralism in this issue area affect our collective action? And how can we complement rather than compete with established multilateral processes? I very much look forward to hearing from our speakers and the discussion. I will now hand over to my colleague, Daniela Moric, who will introduce our speakers and will moderate the event. Thank you very much.
Excellent. Thank you very much, Suerie, and good morning, everyone. It's wonderful to see so many of you here and also so many people joining us online. My name is Daniela Moric. I work at the Global Health Center, and I will have the pleasure of moderating this discussion today. Let me just start with a few housekeeping announcements. So this event is streamed live and recorded, and we'll make available the recording on the Global Health Platform website in a few days. And the website address will be shared with you at the end of the event. It will be shared also in the WebEx chat right now. In terms of how we're going to organize our time together, I will guide a few round of questions with the panelists, and then I will open for a Q&A later. So if you are in the room and you want to ask a question, I'll ask you just to raise your hands. But if you are joining us online, please type your question in the chat box. I have access to the chat box here at the stage, and I will have the pleasure of directing your question straight to our speakers. So let's now start. We are joined today here by a panel of esteemed experts, and starting from my left, we have Diarmaid Campbell-Lejeune, head of unit at the Climate Change, Energy and Air Quality at the World Health Organization. We also have Miguel Ruiz Botero, second secretary at the Permanent Mission of Colombia to the United Nations here in Geneva. And joining us online, we have Margarita Gutierrez, policy advisor at the Friends of Climate and Health at the International Institute for Sustainable Development, and also representing the government of Turkey, who will be the COP31 president, as mentioned by my colleague, and also who will host, I see you, Ömer, waving, is Ömer Öztürk, head of the Department of Adaptation to Climate Change and Local Policies at the Directorate of Climate Change at the Ministry of Environment, Urbanization and Climate Change of the Republic of Turkey. We were supposed to also have another speaker from the Ministry of Health. I don't see her quite yet, but maybe she will join us later, and I will introduce her when she joins the call. But thank you all of you for being here today with us, and I think that now we can start. And I'll start with Margarita Gutierrez, who's joining us online. You can see her on the screen. And so, Margarita, you've been following the climate negotiation for a long time, and there's been a growing effort in elevating health within those processes. And COP30, the last COP that was held in Belém in Brazil in November 2025, was an important milestone in that regard. So from your perspective, what did COP deliver for the climate change and health agenda, and where does it still fall short, in your opinion?
Thank you so much for having me here, and good morning to everyone. Yes, we have been working on this issue, and it is important to note first that the UNFCCC process is one of the most advanced process shaping economy and political views and decisions in the ground. So that's, and it's one of the more than 60 environmental multilateral agendas that really has succeeded on that. So everybody wants to be there. And that's also very important to understand, because this is what makes complex the negotiation every time, and every COP is more complex than the one that was before. So like every sector, every regional space, every country and group of country wants to have their text under the negotiation agenda. One of the main points that we wanted to do with the health agenda is to understand where are those gaps and where we can build the space to put that on the agenda. The initial ideas and what we have been working is to have a space, a dedicated space, an item agenda or a dialogue or some result that can put countries to talk about health and climate. Despite this was not the result, it was the first COP where this path really emerged, and with discussions on where to put climate and health agenda, it was under the table, and many countries pushed to have a space dedicated to understand that. And as a result, we see that this is a COP where health is for the first time delivered as a strategic point, not only from the adaptation part or having to have be one of the sectors that responds to the impacts of climate change, but also as the human side of the climate change and a key entry point to understand how climate change is going to affect us all. So I think this is very important and is reflected in the Mutirao decision. The Mutirao decision is the cover decision, that is a decision where it's not linked to a specific track in the negotiation, that is very complex agenda, as I already said, but it's a decision where many issues that the countries raise are put together. And it is important to set the precedent that it's there not only recognized as one of the key entry points for adaptation, but also as a key entry point for understanding co-benefits and to understanding why climate action it is important. And it's related to putting human and people and communities in the center of the climate policy. The second very important and big win that we have in the COP30 result is, of course, the global goal of adaptation indicators decisions, where from the Paris Agreement has already established that we have health as one of the main issues that we have to tackle. But here the importance is that after 2 years of a process that have last 2 years, that have bring people from experts from countries, from ministries of health, for international experts, really could make and establish a path to understand how we need to tackle this, to discuss this. And the result, even it is not perfect, even it has problems in the procedural at the end of the decisions, even many countries are not happy with them, it's an important key cornerstone to understand that we have a common set of indicators that we need to keep working on that, but are like a central piece of how we can understand climate action and how we can understand and measure what the world is going to do with the adaptation and with regards to health and climate. This is super important because this type of discussions are always very difficult to have because everyone has different local approaches. But at the end, the success of the UNFCCC process has, from the mitigation point of view, to aggregate on one established measure, that is CO2, that really is not perfect at all, but pragmatically measure what we have recognized as a big problem. And we need to do something like that with adaptation and with other human measurements to understand how we are going to move together and how we can add to a specific goal that we have. And finally, the third big win that we have is that this, especially this COP that was the COP of the people, really supports how to advance in the non-state actor participation and really understand that we wanted everybody to talk about that. And as the center of this panel is, we need to understand how to complement and rather than compete in these agendas. And this is super important, and it mobilized many people. We had a health day, we had big discussions there, and we had a Belén action plan for health, trying to understand and to prove that even non-state actors related to state actors that are not the ones responsible for the negotiation tracks, as in this case, ministries of health, need to assure their action and need to understand and mainstreaming climate in their own policies. And we also there, we can see how combining efforts, understanding and sharing lessons, and even putting some important issues as indigenous knowledge for health and climate, for understanding the process, are going to be a very important leverage to mobilize action that is the most important goal that we all have in this moment. So I would say that those are the three main points. We have still gaps and we have still work ahead to streamline health and climate change more in the agenda, to understand and to see what we are going to do with the indicators that are already there, and to understand and see how this could translate into more finance coherence and adaptation improvement in our lives. But I think that those are the main 3 points that we wanted to make.
Excellent. Thank you very much, Margarita, for this overview on the advances achieved at the last COP. I would like now to turn to Miguel. Colombia has been very active in advancing this agenda, so at the intersection of climate and health. You have announced the Santa Marta Conference, the first international conference on transitioning away from fossil fuel. This was announced after COP30. Margarita mentioned the cover decision and what is in the cover decision, but probably there was less about fossil fuel. There was not a decision on phasing out. And afterwards, there was this announcement of Colombia, jointly with the government of the Netherlands, to organize this first Santa Marta Conference. Can you tell us a bit about this conference and what are the concrete outcomes that you would like to achieve through this event at the end of April, if I'm not mistaken?
Yes, of course. First of all, thank you very much to the Graduate Institute for the invitation and to the Geneva Environment Network for organizing these events. As for the Santa Marta Conference, a couple of points. The first, I think, is the Santa Marta Conference was conceived essentially as an escape valve for some issues of negotiation that were not making enough progress at COP processes. And of course, those that not only are not making enough progress within the COP processes, but also that a large majority of countries interpret as being of an extremely urgent nature. And I'm sure we'll talk about it a bit further when we discuss two-speed multilateralism. But essentially, what we've attempted to do together with the government of the Netherlands and a very large coalition of countries which have signed up to this initiative is to provide a forum where we can have those discussions without generally having the same circular discussions about procedure and about issues that are generally seen as controversial. That does mean that we've had to, in the interest of time and in the interest of prioritizing, focus our efforts essentially on three pillars, mainly linked to mitigation, adaptation. And the idea is that we will be producing documents at the end of the conference, and the outcome documents are essentially thought out as identifying pathways for transitioning away from fossil fuels in a variety of fields. While we don't necessarily include the issue of climate change and health explicitly, I think it's important as well to acknowledge that there is an intrinsic link between the issues of climate change and health. The way that my country looks at this is that climate change, aside from being an environmental crisis, is essentially the largest human rights crisis of our time. And the adverse effects of climate change are linked to adverse effects on the full enjoyment of human rights. And that does not only affect collective rights, such as the right to a clean, healthy, and sustainable environment, the right to development, but also individual rights, and particularly among those is the right to the enjoyment of the highest attainable standard of health. There's essentially two very clear linkages. First, the adverse effects of climate change are affecting the individual health of people, and particularly in those countries which are most vulnerable to climate change, which generally are developing countries. And so those countries that have contributed the least to configuring the crisis that we are living today, the people that are most vulnerable within those countries are the ones that are seeing the most affectations to their health. That is extremely problematic in the sense that not only are these countries having to respond to the crisis of climate change from a technical standpoint, so to the environmental crisis itself, but are also having to go even deeper into their fiscal spaces to respond to these externalities that are being created in other fields, particularly in the field of health. And so our view is that as we respond particularly to the issues of mitigation and adaptation, we will also be advancing the right to health of these individuals. The second issue that's also very important is to understand and recognize the fact that health systems, and particularly the health sector, is a particularly energy-intensive sector, and a sector that does not necessarily conduct itself in the most sustainable manner. And so there is an equilibrium to be struck between sustainability and the provision of the best available healthcare. There are a few discussions to be had as relates to fossil fuels in the sense that this is a sector, for example, that utilizes not only a very large amount of energy, but a very large amount of petrochemicals, particularly single-use plastics, which could be replaced by durables, could be replaced by other materials. So that's another discussion that's important to have. But these will be contained within the larger discussions, and hopefully as we build up to a follow-up process and potentially a second conference or whatever form that follow-up process takes, this is an issue that will be further embedded into these discussions and further streamlined so that we can have more progress as well on the explicit intersection between climate change and health.
Excellent. Thank you. Very exhaustive. I would like now to turn to WHO. The World Health Organization has been a leader and has in advancing the climate and health agenda. The World Health Assembly last year adopted the first global action plan for climate change and health. And my question would be, so how is it going? How is it progressive, the implementation, and what are the greatest challenge the country faces now in this implementation phase?
Thanks so much for the question, and thanks for the invitation to be here. And it's nice and it's interesting that you're framing this around this is the first global action plan and how is it going so far in the less than a year since we've approved that. But I think if I can just take a step back a little bit, because I think I'm really interested in this framing that you have around two-speed multilateralism. I'll come back to that in a second, but there's also a big issue, which is effectively two-track multilateralism, because the climate change is a huge issue. It's all of the things that people have described so far. It's the biggest human rights challenge, probably the biggest health challenge, potentially the biggest economic challenge, because it's absolutely embedded in our economic systems and so on. And that's why the COPs are so big and have been going on for more than 31 years now. So that's a huge negotiation effort. And then you have health, which is also one of the absolute top priorities for people in the street or for national governments. And that has its own governance. And part of the big challenge that we have in this issue is that, as we've heard, these things are intricately interlinked. Climate determines people's health. The drivers of climate change, particularly the burning of fossil fuels, kill about as many people as any other health risk factor that we have. These things are, in reality, very closely interlinked. And yet we mainly have a negotiation track for climate and a negotiation track for health. And the story, and I've been involved in this issue for 26 years now, has been trying to strengthen those connections between the two, because in general we're better at dealing with one track of things and another track of things, not very good at the joins. There's an old professor of mine who used to say, yes, intersectoral work, blessed by everybody, funded by nobody, because it's hard to get the incentives to solve these sort of intersectoral issues. So I think that's another dimension of what we're looking at. Two tracks, two speeds is important, but two track is also important. And to get back to your question, because the Global Action Plan is simply the most recent iteration of a story that goes back more than 20 years. So my first COP was 2003 in Milan. So yes, I am that old. There's grey hair. Most of the grey hair is actually from COPs. The other half is from World. WHO is the other half. So we've been trying to put this item on the agenda, and in fact, my first COP in Milan, we launched the first WHO results that said climate change is killing. At the time, the figure was 150,000 people a year. We had a quantitative assessment. That made headlines. That was on the front cover of newspapers. So it's a story, but that didn't mean it got embedded in the negotiations really on either side, because it was easy to say that's somebody else's problem. So climate change and health, yeah, that's important. In the climate space, they'd say, well, WHO should deal with that. And the other way around in the health space, that's mainly an issue for the Ministry of Environment. So I spent a very long time sort of building up the evidence, building up the case for why we should do these things together. And I don't want to, you might imagine that we would be trying to really sell our Global Action Plan as this wonderful new thing. And it is really important. And we have people who are involved in the negotiations from some of our member states who supported the World Health Assembly resolution the year that preceded it, and then these very difficult negotiations to get it through. And they were difficult because some countries had different interests. They, to be honest, didn't really want to hear too much about mitigation from around the World Health Assembly. But it was it was the next step of moving this ball forward, because the actual practical agenda, not to give away too many secrets, is not that complicated. When we talk about health adaptation to climate change, there are a series of interventions that we know work. So if you've got a good functioning health system, you're much better protected from the health risks of climate change, heat waves, infectious disease, malnutrition, and so on. If you have that in place, you're much better protected. We can already identify there are a series of interventions like heat health warning plans, or providing good water and sanitation provision that's also resilient to climate change, providing renewable energy for healthcare facilities, or putting an appropriate price on carbon. All of these, we can show how they would have a massive benefit to cost ratio, would save, just 5 interventions that we've assessed, would save about 2 million lives a year. Again, comparable to anything else we can do in health. And we have all of that evidence. So I don't want to make this sort of overly complicated. We can get into the details of how that differs between different countries, but the bottom line is that we know what to do in order to protect people's lives from climate change, and we know that these are good deals. And the same on the mitigation side. So we would say that health is the strongest argument for why you should mitigate climate change, because people in the street care about the fact that climate change, in the words of the IPCC, threatens to misses the opportunity to miss a rapidly closing window on a livable future for humanity. Now that matters when you think about your own life or your children's life and so on. That matters to people. But the other part of the argument, just to sum this up, is when we talk about, for example, the conference in Santa Marta, one of the big arguments for why we should be transitioning away from fossil fuels is because air pollution kills about 7 million people a year. Probably over half of that is due to fossil fuel combustion. The value of the health gains that you would get from transitioning away from fossil fuels actually cover the cost of doing it. So you could make that case for, or we could collectively make that case for phasing out of fossil fuels, even if we weren't worried about climate change. It already makes sense. And I have to say, it makes even more sense to transition away from fossil fuels when you see, the war in the Middle East and so on. But to sum up, we have this big challenge that we're better at dealing with individual discrete problems where we can say, there's a virus, we need to roll out the public health measures. We're less good at dealing with a problem where there are multiple arguments for why you should do a thing. So there are health arguments, human rights arguments, environmental arguments, and so on, for economic arguments for why we should phase out fossil fuels. And when I would say, again, with respect to the diplomats in the room, our negotiation systems are less well set up to deal with those kinds of challenges. So the Global Action Plan integrates all of those things that we've known for a long time are really good things to do, and it simply puts the World Health Assembly endorsement on it. And taking us back to the climate change negotiations, the Belém Health Action Plan endorsed through the last COP has much of the same content because we don't want to set up two different agendas that overcomplicate the issue, that get in the way of rolling out heat health action plans, getting off fossil fuels, monitoring that and tracking that and so on. So not to undermine our global action plan, it's really, really important, but it is just sort of the next step in this long-running battle, if you like.
I just have a quick follow-up. So this WHA will look into the implementation of the Global Action Plan, or it's for the next one?
Formally, we don't report on it at this current World Health Assembly. We will do that at the next one. But because climate change is so important, there are multiple events around the World Health Assembly. Our colleagues from Peru are advancing one. There will be a high-level event, probably championed by the incoming COP presidencies and previous COP presidencies, about ensuring health stays on the agenda for future COPs, because it has to, because these issues are so interlinked. So it will be widespread across the discussions, but not on the formal agenda this year.
Okay, excellent. Thank you. We will keep monitoring. Now, let me turn to COP31. We have here with us Ömer Öztürk, working with the Ministry of Environment. Turkey will be the president of COP31 and also will host the gathering in November in Antalya. Hi, Ömer. Could you tell us a bit about what is the COP31 presidency vision and key priorities for the conference, including in the climate and health space? We heard something from Jarmid now, but I don't want to. I give you the floor to tell us a bit more.
Daniela, thank you very much. Thank you for giving me the floor and having me today. Now we are about to take the flag from Brazil and move forward this flag for a COP to feature. As you know, because we aim to bring everyone together, we want to be the main bridge for every country and every parties, as you know. Thank you very much again. As COP31 presidency and host the conference in Antalya, our main vision is very clear. Move from commitments to implementation. We want to be as an implementation COP in Antalya as COP31 incoming presidency. This will provide a concrete focus on adaptation, resilience, and inclusive action, particularly for developing countries. As you know, we are very aware of their needs, and we want to be a clear bridge for them. On the other hand, we identify ourselves, as I mentioned before, a bridge between different regions in the world, and we are preparing a comprehensive action agenda with this understanding, and hopefully we will announce it to the world during one sessions this June. In this context, we evaluate health and climate nexus, a cross-cutting priority across key such areas such human development, food systems, and urban resilience, if I may give some examples about that. Our goal is, in summary, is to ensure that health considerations are fully integrated into climate policies, because we see that as a cross-cutting issue, and we give this a great importance, and especially in face of rising risks such as extreme heat, air pollution, and water stress. On the other hand, Turkey will assume the COP31 presidency with a clear vision to translate global climate commitments into tangible action, while strengthening dialogue and fostering meaningful consensus across parties. So we have a strong motto: action, dialogue, and consensus. As we prepare to host the conference in Antalya, our other priority is to position as an implementation-oriented COP, one that accelerates adaptation efforts, enhances resilience, and delivers practical solutions, particularly for developing countries and other regions. In this context, we aim to promote inclusive and trust-based dialogue among parties, ensuring that diverse perspectives are reflected and that no one is left behind. This is our first starting point. At the same time, building consensus will be central to advancing key areas, including adaptation, as you know, finance, capacity, technology, and cross-cutting issues as the climate health nexus can be added. Through a balanced approach that brings together actions on the ground, constructive dialogue at the political level, and consensus within the multilateral system, Turkey also seeks to contribute to a more effective, responsive, and comprehensive global climate action. On the other hand, we aim COP31 to deliver practical solutions that can be implemented at national and local levels. As the incoming COP presidency, Turkey's vision for the conference in Antalya is shaped around, as I mentioned before, clear and unifying motto. I would like you to note that: action, dialogue, and consensus. This reflects a deliberate shift from setting ambitions to delivering concrete results on ground, while ensuring that inclusive dialogue continues to guide collective progress. On the other hand, incoming presidency aims to position COP31 as a turning point where commitments are translated into measurable outcomes. At the heart of this vision lies the objective of closing the implementation gap. On the other hand, if I add, while global frameworks and pledges have significantly advanced, the real challenge remains turning these into bankable projects, investments, and tangible impacts. You know, the main challenge of the adaptation is the gap between the reality and the future, and we would like to guide the banks and financial institutions for more bankable projects, scalable investments, and move forward the projects all around the world and answer for the needs of developing countries and bring them together with developed countries. On the other hand, the presidency's priorities are structured around the comprehensive and action-oriented agenda, spanning energy, industry, transport, transformation, nature and biodiversity, agriculture and food systems, cities, infrastructure and water resilience, and human and social development. Across these areas, cross-cutting themes such as resilience, zero waste, clean energy transition, food security, and climate resilience, these are planned to guide integrated solutions. In addition, this holistic framework will ensure that climate action is not only ambitious, but also inclusive, practical, and scalable across regions in the world. COP31 aims to transform national climate plans into investment-ready pipelines, bankable projects. And in this context, Turkey also seeks to position itself as a regional hub for climate solutions, facilitating knowledge sharing between the parties and regions and stakeholders. Finally, consistent with the principle of dialogue, the presidency will foster inclusive and multi-level engagement, bringing together governments, cities, private sector actors, financial institutions, civil society, youth, and academia. This collective approach for us is essential to ensure that climate solutions are co-created, locally, especially locally grounded, and globally scalable. In this context, COP31 vision is not only as a negotiation platform, but as a delivery of one that operationalizes the motto of action, dialogue, and consensus, and advances result-driven process. Thank you very much, Daniela.
Thank you very much for giving us this overview and preview on what to expect from COP31. I've seen that we have another panelist who has joined our call, and this is Dr. Gül Mersilioğlu Serin, who is an health expert at the Ministry of Health of the Republic of Turkey. We are very happy to have you with us, Gül, and it's a perfect timing so that I can transition to you and ask you, how is the Ministry of Health of Turkey planning to address and advance the climate and health agenda within COP31, and what are the main initiatives that you are currently planning in the lead up to the gathering in November? And welcome. Glad that you could join us.
My pleasure. Thank you, Diana, for giving the floor me. Distinguished participants, climate change is no longer solely an environmental concern. It is a defining public health challenge of our time, as also recognized by the World Health Organization. Its impact ranging from health-related mortality to food insecurity and the speed of the vector-borne diseases are already being felt across all regions, with disproportionate effects on the most vulnerable. Addressing this complex nexus requires not only strong multilateralism, but also more agile and complementary form of cooperation. In this context, Turkey fully acknowledges of the evolving landscape of the global governance, including the emergency of what is often referred to as two-speed multilateralism. We see value in the both tracks, the inclusiveness and legitimacy of the UN system, alongside the dynamism of the coalition of voluntary initiatives that can accelerate progress. This approach should be mutually reinforcing, particularly in advancing the climate and health agenda. Looking ahead to COP31, which Turkey will host in Antalya in November 2026. We see a unique opportunity to further elevate health within the climate negotiations. Building on momentum of the recent COPs, we are committed to ensuring that the health dimension is more systematically integrated into climate policies and discussions. In this regard, the continuation of the Health Day, first launched at the COP28, will be a key priority for us. The exact date within the COP31 health program is still not finalized, but preparations are actively ongoing to ensure that this thematic day is impactful, inclusive, and result-oriented. We are determined to make Health Day a platform that brings all together policymakers, including ministers, experts, and stakeholders to deliver concrete and acknowledgeable outcomes. We attach great importance to partnership in this process. Turkey remains fully open to close cooperation with the WHO, international organizations, civil societies, and other relevant stakeholders to shape and deliver a strong Health Day agenda. In particular, we are looking in coordination with Brazil and Australia to ensure continuity and coherence across COP process. In this context, we are planning to co-organize together with Brazil a high-level side event on climate change and health during the upcoming 79th World Health Assembly. This event will provide a valuable opportunity to strengthen high-level dialogue, exchange best practice and experiences, and advance collective efforts to further integrate health consideration into global climate action. Furthermore, Turkey supports the effective implementation of the Belém Health Action Plan adopted at COP30. We consider this action plan a critical framework for translating political commitments into tangible actions, particularly in strengthening climate resilient and low-carbon health systems. In completion, as we move from COP30 to COP31, Turkey stands ready to play an active, constructive, and bridging role, bringing together different actors, approaches, and levels of ambitions. Our objective is clear: to ensure that health is firmly anchored at the heart of the global climate agenda, and that our collective efforts deliver real benefit for people and communities worldwide. Lastly, looking forward to see you in Antalya. I thank you, Diana.
Thank you.
Thank you.
Oh, there is an echo. No, there's not an echo anymore. So good to hear that there's going to be a high-level event with Brazil, the next WHA, and also a thematic day during the COP. Excellent news. I know that, Diarmid, you're probably going to have to leave before the end of the panel. So I want to, if I can, ask you another question about this two-speed multilateralism. So how is WHO planning on engaging with this different initiative, and what kind of opportunity do you see there for advancing your work?
Thanks so much, and apologies, I will have to leave, but my colleagues will be online and able to answer any questions. But I think this two-speed multilateralism is really important for us. You know, we're a UN agency. We will always support the UN process. We absolutely value the fact that all member states go to the World Health Assembly or go to the UNFCCC COP, and considering, for example, that small island developing states are some of the most vulnerable to climate change, it's really important that they have the weight, the equal weight, to be able to stop the process and say, you know, we need you to take care of Vanuatu or Tuvalu in the same way that you take care of, you know, the US or China or one of the big powers. So we absolutely value and respect that. But having said that, you know, as an agency which is driven by values, so our values are about equality, leaving nobody behind, and, you know, ensuring the highest quality of health for everybody in the world, and we're driven by evidence. We are also very comfortable going to another meeting, for example, supporting the conference in Santa Marta, or the initiative that Peru and the Netherlands are taking, or anybody else who in a separate meeting will advance any part of the agenda which is consistent with the values and consistent with the evidence. And so to give one example of that, WHO is, I think, still the only agency which has signed up to the call for a fossil fuel non-proliferation treaty, because when you look at the text of that call, it's entirely consistent with protecting people's health, and there is nothing in there which is not evidence-based. So we'll say we'll support that. That's separate from the UNFCCC. It's separate from the WHA, but we feel comfortable endorsing that because it's based on public health values, it's based on equality, and it's based on scientific evidence. And we would say the same to any initiative that supports that. And I do think this two-speed process is really important, because the downside of having that completely inclusive process within the UNFCCC or the WHA, which tends to will usually try and reach agreements by consensus, is that it's the floor of ambition. It's not the highest level of ambition. So it's really important from that regard. But if a certain subset of parties or countries can take part of the agenda that moves things in a positive way, as was referenced in the opening statements, then that has to be supported, I think, as well. So anything that supports a fair and just transition away from fossil fuels, a fair and just transition to clean energy, a reduction in air pollution, a reduction in preventable deaths, we're very happy to put our evidence and our voice behind as well. And thank you once again for the invitation. I will need to sneak off. Thank you.
No worries. Thank you very much, Diarmid. I'd like to continue now with Margarita. And also, Diarmid mentioned the importance of this connection. And I know, Margarita, that you've been working a lot in bridging connection between the climate and health communities, especially through the initiative of the Friends of Climate and Health. So my question for you is, how effectively are these two communities working together? Are they improving their collaboration? And do you see opportunity to accelerate actually this coordination for an increased impact?
Thank you, Diana. And yes, absolutely. We have seen that thanks to many of the work that WHO has been made for the last 20 or more years, it is important to understand that two communities that doesn't talk to each other, that doesn't relate to each other, are very difficult to have a common goal. And the fact that we are now seeing that the communities in the national levels, regional levels, international levels of health community and the climate community trying to understand, because this is a translation. This is different language, and this happens with all the sectors. Mainstreaming climate change into sectoral affairs has a key cornerstone of how to deal with climate and how to understand where are the responsibilities of everybody, because everybody has responsibilities, and that's what Paris Agreement recognized for the first time in the negotiation. And these two communities has been working more closely together. That also implies not only the negotiation part, but also the decision part in every country, where finance ministers go apart from health ministers, go apart from environmental ministers, and go apart for cities, NGOs, social communities, etc. I think that the big challenge, but also the big opportunity that climate change has put on our humankind is understand how we need to collaborate and how we need to differentiate our responsibilities, but bring together some common goal, and how we can translate that into synergies, into understanding each other, into hearing each other, even in our neighborhoods countries, and even in countries that are not close to us, but they relate to some of our realities, how we can exchange that and how we can learn from that. And I think that these platforms that we have been talking about, it's also on to understand how others are trying to tackling the challenges that we are facing and how we can translate that. We have some important countries that, including Colombia, including some of the Asia Pacific countries that have been working a lot in this mainstreaming and in this joint action from the 90s. And now they are putting ahead and putting the examples on how we are going to deal with that. And this is the main challenge. I think that also what WHO representative was saying is super important, that we need to understand how this is going to take into account into the complete global stock take. We need every country to put that into the transparency framework that we have, into the NDCs, into the national determined contribution for climate change, into the biannual report. We are putting their information that are very important for understanding globally how this works. And if we don't see in the next GST result an important amount of people talking about health interactions with climate and understanding how this is a human problem, and all, but also the possible solution and the more cost-effective solution that we have, it is going to be very difficult to put into the agendas of the climate negotiators the relevance of health. So I think this has to be two ways. It's not only that the actions need to be coherent, but also that the politics, the decisions, and the interaction that the climate community puts into health really matters and really show to the world how is working together these two communities. We think that there is this is a very hard work that many people have been involved with, but it's in crescendo. It's going up, the interactions, the coordinations, and for example, the GGA is one opportunity to understand how we are going to deal with that in every country, how we can make alliance into regionals or even further countries that are similar, how we are going to understand how it's better to measure that and put that message together. And yes, in the Friends, we have been developing some encounter spaces to understand, because sometimes the time, it's the more valuable asset that we have, that we don't have. And the time to deal with this is super important. So we put together national experts, international experts, but also regional negotiators and ministries of health, cities. This is like the kind of action that really will bring results. And that's so important in improving communication, understanding each other, and also understanding that there is a need of the common ground, and how we deal and how we focus and understand that common ground is like the key of how we are going to coordinate.
Excellent. Thank you, Margarita. Very clear. I would like now to turn to Miguel and coming back on this concept of the two-speed multilateralism. And you explain with the announcement of the Santa Marta conference how this is important. I'm wondering, do you think that this also has the risk of fragmenting or slowing down global efforts? And I'm wondering, you talk about the outcome that you would like to see from the conference. Do you think that they should be picked up also in the traditional global climate architecture, or what would be your wish to see on the outcomes? Thank you.
Yeah. Thank you. So as to whether this has a risk of fragmentation or of potential negative effects, I think it's important to make one distinction. I think Professor Moon was pointing to that in her opening statement, that we have many examples of multilateralism and bilateral discussions on global problems, and that's not new. I mean, you can take a look at the Yalta Conference and many other examples, and I think we have quite a few today that are being built up. as to plurilateralism or minilateralism, which is based on an exclusionary basis. And that is, well, the United Nations is based on this notion that all countries are of sovereign equality, right? We are all equal. But these processes have been built on the notion that, sure, we're all equal, but some are more equal than others. And so that generally powerful countries can decide on global issues amongst themselves and their friends, and that others aren't necessarily to be invited to those conversations. This is precisely the opposite logic. And I'll just explain where this comes from, because I think it's important. We made a fatal mistake when we set up the climate regime, the desertification regime, and the biodiversity regime, so altogether the Rio conventions, to rely exclusively, and I do say exclusively is the operative verb here, on consensus to make substantive decisions. Many countries will tell you that that's normal and that's what has always been in the environmental field, and that's simply not true. You can take a look at how the Ramsar Convention operates, how CITES operates, which are conventions that were negotiated and entered into force in the 70s, which were the first environmental conventions, and these very much have provisions that go beyond consensus. Now, deciding by consensus on substantive issues is important. It is ideal, because deciding on a consensus basis helps you to have buy-in into the solutions that we all agree to do. And that makes these solutions materialize in a much more viable manner. And so even in many bodies which do not have this requirement for exclusively operating on the basis of consensus, for example, the General Assembly, we still have a very strong preference for taking decisions by consensus, and a very large majority of those decisions that are taken by consensus. But the possibility to vote on decisions actually makes decisions being taken by consensus much more likely than it would be if that possibly were not there. There is an incentive for countries to compromise and to find solutions that are truly acceptable to all when that exists. And so we did not do that with the climate regime, and we only take those substantive decisions by consensus. Why is that problematic? Because at the time we thought this is something that we will all do in good faith, and we're going to try to find global solutions to global problems, and every state will contribute as best as it can to actually fix these issues. Sadly, we've seen that the logic has been put on its head, and that consensus has been, in essence, weaponized by a few countries to obstruct progress. And so what we have is a regime which advances at what we would call in common parlance in Colombia, at the 3 speeds of the donkey, which are slow, very slow, and stationary. And so the way that we see this is that this creates a strong disconnect.
Can you actually?
Sorry. Yeah. This creates a very strong disconnect between what science tells us is the timeline where we need to take actions and the actual timeline at which we're taking actions. Because even at the high speed, which is slow, we are decades behind what the best available science tells us we need to be doing. And so that's why we thought that it was very important for this issue, but for other issues as well, to create a logic of plurilateralism that is not based on exclusion, but is based on willingness. And so the Santa Marta Conference is based on the concept of a coalition of the willing. It is not that we don't want to discuss with countries that have doubts. It is that we understand that they have doubts, and we very much respect their right to say, well, we don't want to participate in this. But what we don't agree with is that they would then, because they have doubts, have a right to obstruct the entirety of the system for moving forward in a more ambitious and decisive manner. And so those countries that are willing, and not only those countries that are willing, but also the scientific community, the academic community, non-state actors as well, who are willing to contribute to moving faster on these issues that are urgent, need to come together, and they need to have a forum for actually making these things go faster. That is what we're trying to do with Santa Marta. That's also why we think it's very important that this has an outcome, that outcome has a follow-up process, and that we can build upon that. If that's taken up by the COP process, that's fantastic, and that's also a very important, very legitimate process. And we would very much have liked to achieve these things within that regular process. So if that's possible, fantastic. If it isn't, we do think that it's important to have that forum going forward. And just another point, this is something that also has precedence, not necessarily in the environmental field, but for example, in the disarmament field. We attempted to negotiate in the 90s and the beginning of the 2000s a convention on anti-personnel mines within the confines of the United Nations. That proved to be impossible precisely because of the rule of decision-making by consensus. And so Canada and a few others decided, well, we really want to do this. We think this is an urgent problem and something that needs to be fixed. And so they took that to what is called the Ottawa process. And the Ottawa process was very much this, a coalition of the willing. And that coalition of the willing gave us what is now the Ottawa Convention, which is universalizing, well, now a bit less, but it is a process with a very large appeal, which has essentially banned anti-personnel mines in a large portion of the world. We did that as well with the Arms Trade Treaty, when we couldn't agree to its adoption. And some countries said, well, we're not going to stay with this process frozen forever. And they took it to the General Assembly for adoption. And now we have an Arms Trade Treaty. And so essentially what we're trying to say is we are not satisfied with the notion that consensus can be weaponized to obstruct progress. We will find ways to make the progress that we need to make. And if that can be done in the regular processes, we'll be happy to do that. If it can't, we are committed to finding alternatives so that we can find solutions to the problems that the world faces.
Thank you, very clear. I'm realizing that we are a bit behind schedule, but I would like to turn again to hear from our colleagues from the government of Turkey, and specifically to Ömer Öztürk. I have also a question for you related to this two-speed multilateralism. How is the COP31 presidency be engaging with these other processes, and how can they support the work and the agenda of this presidency, of this incoming presidency?
Thank you, Daniela. I will just try to be very brief. As you know, we see emerging two-speed approaches not as a substitute to the multilateral system, but as a complementary mechanism that can help accelerate global progress, global action agenda. It's equally important to ensure that these initiatives remain inclusive and aligned with the UNFCCC process and the Paris Agreement. In addition, as COP31 incoming presidency took aims to connect these initiatives with the broader multilateral framework and ensuring that successful experiences are shared globally, and see the best practices and how we can help countries from developing parties and least developed countries. In this sense, we see this as an opportunity to turn flexibility into acceleration, as you know. As the incoming COP31 presidency, we recognize that emerging forms of two-speed multilateralism are becoming an increasingly important feature for global climate architecture. According to outcomes of COP30, we aim to engage with parties and listen everyone and answer every needs as we can, and relevant stakeholders to bridge the needs, ambitions, and implementation. If I can add another issue, the presidency plans to prioritize aligning initiatives and national priorities and needs. As you know, during the COP30, during the GJ negotiations, every party had a different need, and everyone wanted to announce its voice on the ground and wanted to see their priorities in the list of the final list of indicators. On the other hand, we aim to strengthen public health, social resilience, and adaptive capacity, ensuring a more inclusive and implementation-driven global climate response. On the other hand, COP30 was a turning point for adaptation agenda. As my colleague Margarita mentioned, the 59 indicators adapted under the global adaptation. This surely represents a historical step in measuring adaptation efforts. As you know, for the first time, we are trying to measure the adaptation needs, and we will test it. Maybe we will test it in Antalya for the first time, and we will see what are the main needs and what should be done to move forward this process. Within these indicators, I mean these 59 indicators, the health dimension is strongly reflected under the pillars of exposure, vulnerability, and capacity. In particular, heat-related mortality, air quality, and its health impacts, climate-sensitive diseases, and the resilience of health systems hopefully will become measurable. At this point, evidence-based policy making, strategic data and monitoring systems, and enhancing country-level capacity become more and more important these days. However, the key question for us is how do we translate these frameworks into action on the ground? Therefore, our expectation from COP31 is the first starting point of GJ indicators, particularly in health dimension and the delivery of a strong political signal in this area. Thank you very much, Daniela.
Thank you. And I have one last question for Gul. And meanwhile, I'll also ask you to prepare your question. We don't have a lot of time, but we should be able to gather at least a few of them. And also we have a representative of the Permanent Mission of Australia who would like to take the floor after the panel discussion. Gul, we have several representatives of the global health community here in Geneva. And can you just share a few thoughts on how do you think that this community can engage and contribute to the vision that you highlighted before for COP31? What can we do to help?
Thank you, Diana, if I pronounce this correctly, sorry for that. We will establish a dedicated technical committee to address the technical aspect of the climate and health agenda under COP31. The issues discussed will be formally submitted to the committee for further assessment and development. Our vision is to ensure that climate and health is addressed in a structured, evidence-based, and action-oriented manner. In the lead-up to November, we will guide the preparation process through inclusive engagement with all relevant global stakeholders. We will follow a multi-sectoral and multi-stakeholder approach, ensuring alignment across health, environment, and related actors. On the other hand, the global health community can contribute by actively engaging in the technical preparation process. Expert input, data sharing, and the best practices will be essential to strengthen the evidence base. Partners in Geneva and beyond can support coordination, capacity building, and knowledge exchange. The inclusive participation in the consultation and the technical discussion will be key to achieving our shared vision. Thank you.
Excellent. Thank you very much. Thank you very much. I'm now ready to open the Q&A session, but first of all, I would like to give the floor to Margot Morris, Counselor at the Permanent Mission of Australia. As you know, Australia will be playing the key role of President of Negotiations, and maybe you can share with us your vision as well for your upcoming work on the COP31.
Thank you. Thank you so much. Thank you for convening this really important discussion, and thank you so much to all of the panelists for sharing your perspectives and your reflections. I just wanted to give a couple of comments from Australia's perspective. We are really proud to work with Turkey, a country with whom we have a long shared history, to take COP31 forward in 2026. As has been said, Turkey will host COP31, the COP31 conference, and assume the role of COP president, and has lead responsibility for the action agenda. And Australia will work with Turkey in partnership with the Pacific to strengthen and elevate the action agenda and highlight Pacific priorities. I just really want to underscore that our region is really at the front line of the climate crisis. The impacts of climate change on people's lives and people's health and well-being are already being felt. So we will be President of Negotiations, and we will support a pre-COP in the Pacific, working in partnership with Pacific countries. And we're working hand in hand with Pacific Island Forum members and regional organisations to shine a global spotlight on our region. So COP31 is really, it's an opportunity to bring the world's focus to the impacts of climate change on Pacific nations, including on health systems and communities, and really to highlight the region's leadership in responding to these issues. So we're working with Pacific partners to bring the health perspectives to pre-COP in the Pacific and to COP31. And the last thing I just wanted to note is that COP31 will build on the health leadership from previous COP presidencies. And in particular, we'd really like to thank Brazil for their continued leadership through the development of the Belém Health Action Plan, which Australia endorsed at COP30 in November 2025. I just wanted to share those reflections from Australia's side. Thank you.
Thank you very much to Australia as well. We have a couple of questions. I'll take one or two, and because in the interest of time, we have roughly 1 minute left, but I see one question here. And if you have other questions, please raise your hands.
Thank you very much.
Yes,
it would be more of a statement rather than question. My name is Ivan Ivanov, and I recently retired from the World Health Organization into the State University of Zanzibar. And this has changed my total perspective from all this multilateralism now to how people in countries like Zanzibar are living in such conditions. What all this multilateral and politics and diplomacy means for the daily life, where the climate change, you can feel it, you can feel the heat, you can taste the salt in the groundwater from the intrusion from the ocean, the sea. You are inside the climate change. And what that means for health and how visible our feelings of the climate change and our impacts on health become to the politicians by measuring indicators, by reporting, and by engaging in all this multilateralism. This is important for daily people. And this is what my 120 students in environmental health in the university will ask me next week, what that means for us.
Thank you very much. Is there any other question from the floor? Otherwise, I actually want to build on this intervention. You're bringing us to a different level. And there was another similar question in the chat, which I would like to address to Ömer Öztürk, because I know you are one of the leading experts in local adaptation in your country. And the question says, building on the recognition of green community transformations at COP30, how might COP31 further highlight municipality and local actor-led implementation practices to address the interconnection between climate change, public health, and climate-induced migration? And I know you have a very interesting perspective. You're working on a daily basis on these topics.
Thank you very much for the question. As you know, building on the outcomes during COP30, COP31 can go further by elevating municipality and locally led implementation as a central pillar of climate action. And also in Turkey, we are working very comprehensively on locally led climate adaptation and climate action. And we are preparing locally climate action plans, and it will be implemented next year. I can answer this question with 4 pillars. First one is COP31 can establish a dedicated platform for work stream focused on local implementation, where municipalities and local actors showcase their solutions and address climate change. In addition, public health and climate-induced human mobility. This would also help to move from high-level commitments to practical place-based action and implementation. On the other hand, secondly, COP31 presidency could also promote stronger vertical integration by fostering structured dialogue between national governments and local authorities. Maybe this can be a form of the unit of cities, and also this should ensure that national climate strategies, NDCs, national adaptation plans, local adaptation plans are informed by local realities, particularly in vulnerable communities and vulnerable groups facing high health risk and displacement pressures, maybe. On the other hand, thirdly, COP31 could highlight innovative financing mechanism tailored to local actors, because, as you know, first of all, local communities and local administrations are the first step of facing with the effects of climate change. And finally, maybe showcasing best practice through thematic events during COP31, such as climate resilient urban planning, early warning systems for health risks, and on the other hand, health services and critical infrastructure. Thank you very much, Daniela.
Thank you very much. Thank you. I see that we are over our time, but why don't you join me in a big applause to thank you, our panelists? Thank you very much. You've been very inspiring in your own different ways. I hope that we're going to be able to convene on this theme more in the future. I hope you also will help us driving further this debate. We are at the end, so it's time to thank you. Thank you all the people that have helped us putting this event together, including our participants, both here and online, but also our co-sponsor, the WHO, particularly Marina Maiero and Alexandra Egorova, the International Institute for Sustainable Development, including Eleonora Bonacorsi and Lynn Wegner, the Geneva Environment Network, including Diana Rizzolio and Arvi Parafina, our Graduate Institute events team, and also my colleagues at the Global Health Center, Suerie Moon, and last but absolutely not least, Diana Jalea, who has worked tirelessly behind the scene. Now you are present, you are here. We are all invited to join us for a reception, which will take place outside and upstairs. There should be a last slide showing our next event, which will be the open briefing on the sideline of the WHA on Sunday, May the 17th. Also, if you scan the QR code, you will have access to our latest publication on the global governance of climate change and health. And with this, I would like to thank you all and have a pleasant afternoon. The event is finished.